good afternoon. I want to doing these weekly or bi-weekly little webinars, having different guests on, and we've been focusing mainly on mental health, and obviously May being Mental Health Month, but more importantly, being in the middle of this pandemic and what it's doing to us, not just physically, but also mentally. I think today we know the number across this country of COVID-19 related deaths is over 92,000. And so we pretty much, even though we may not know how many more people are going to be affected physically, I think one thing we can say for sure that mentally, everybody has been affected by this in one way or the other, unfortunately. And a lot of it has to do with the anxiety, the angst of not just the pandemic itself, but the direct and indirect consequences of the pandemic. Half of Americans are saying that their mental health has been affected, and 3 of 4 people are saying their sleep has been affected. I'm one of those 3. I can tell you that right now. I've had some tough times at night, and actually some very intense dreams as well when I am sleeping. So it's been interesting. And I think, to sum it up, I think it was John Steinbeck who said, our Salinas, born and bred author, famous author, said, "A sad soul can kill you quicker, far quicker than a germ," is what quote of his. And I think that's relevant right now during this time when there's been so much focus on the physical aspect of COVID-19 that it overshadows, understandably, but it does overshadow the mental aspect of it. I mean, we've been talking about social distancing and staying at home, shelter in place, wash your hands, wear masks, physical things, but often the mental health aspect of this is forgotten. And so we want to make sure that even though the COVID-19 is amplifying the anxiety and the depression amid this health crisis, that we continue to talk about it. We want to make sure that we have these types of discussions. And so I'm fortunate enough to have with us today, we are fortunate enough to have with us today, Justin Alnos, with NAMI, the National Alliance on Mental Illness. And Justin, just wanted to say thank you very much for joining us today, being able to talk about something that is important to all of us, not just here on the Central Coast, but all across our country. Please tell us, if you could, tell us about NAMI and tell us about your work with NAMI, if you could.
Sure. Thanks again for having us and being able to share our services to such a large audience. We greatly appreciate it. So we're the National Alliance on Mental Illness, also known as NAMI Monterey County. We're a 501c3 nonprofit organization. We're recognized at the national, state, and county levels. Our services are dedicated to improving the quality of life for many affected by mental illness and their families through support, education, and advocacy. NAMI Monterey County offers a variety of free educational programs and support groups in English and Spanish for those who work, live, or care for someone with a mental illness. NAMI started in 1979, and today there are more than 600 affiliates across 48 states. So, in response to COVID-19, NAMI Monterey County, like many of us, had to adapt into the ways in which we provide our services to the community.
Yeah.
Currently, we're providing remote programs via digital platforms such as Zoom and Google Hangouts. These programs can be accessed by computer, tablet, or phone. Our office hours are Monday through Thursday, 8:30 a.m. to 1:30 p.m. At this time, we're not providing services in person. However, you can get a hold of us at 831-422-6264. And you could also reach us at info@namimontereycounty.org, and we'll get back to you.
Great. So give me an idea, give us an idea and the viewers of this live stream and then a eventual video. Tell us about the support programs, the educational programs. What do those entail?
Sure. So in regards to serving our most vulnerable, NAMI Connections is a free peer-led support group for adults living with mental illness. Participants will gain insight from hearing the challenges and successes of others in a group setting led by NAMI trained facilitators who have been there themselves. The group meets several times a month. The next session will be taking place on May 23rd, and it's open to anybody who would like to call in. The session's from 9 a.m. to 10:30 a.m. In addition, we have a peer-to-peer group who's currently taking registration as well. It's an 8-session program. It's free. It's for adults with mental illness as well who are looking to better understand their condition and journey towards recovery. This class is also led by NAMI trained facilitators as well. Typically, the programs help individuals who struggle with mental illness create personalized relapse prevention plans, learn how to interact with care providers, and develop confidence in making decisions and reducing stress, plus much more.
That's great. So if I'm someone and I'm feeling the pressure, be it this pandemic or be it something else, where I'm actually feeling the effects, be it depression, sleeplessness, or some form of effect on my mental health, what should I do? How do I get a hold of you? I mean, is it just simply calling up and then getting into these meetings, or is there an application process, a vetting process? How does that work?
Sure, great question. So our services are free to anybody. Typically, it's through community support. So different agencies being able to spread the word of NAMI. We're on Facebook, we're on Instagram. Individuals can contact us by phone or email, and we'll get back to them as soon as possible. In regards to the programs, since these programs are more geared towards individuals who have lived experience with mental illness, um, we have a variety of questions that make them appropriate to fit the group. Typically, we like to have a confidential space that's supportive. Um, so, those are a few ways.
And how is that confidential space affected by the telecommuting that you're having to do? And how is it secured by the telecommuting? Because I'm sure people are going to want to know about that as well. And you can't just go there and go into a private room. How does it work?
Sure, sure. So, NAMI California has been working with their affiliates throughout the state in the way we provide our services. And currently, what we do is we have our registration list, and we provide those individuals who are interested in taking these programs with with a PIN and access number that's unique to them. That way, there's no Zoom bombing or Google bombing, which is starting to be more common.
That's right. That's right. Good, good. So there are ways that you take. It's not just like you dial in and go to a link like we did up to get on this. You actually have to put in a code, put in a PIN, and then it will come up. And the person is assured of his or her security, that no one else will be able to have access to that as much as you can with that code and the internet that you're using. Is that correct?
Sure. And typically, there's a NAMI staff member being present that's mainly the main administrator for those group sessions, and they typically admit the individuals into the program themselves. So you'll call up if you're dialing by phone, you enter your PIN number, you're placed into a lobby, and then the staff member will verify either the participant's contact information and admit them into the session, or deny them in the session if
Yeah.
they're not included.
Is this something you had been doing before the pandemic, or did you guys have to adapt to take these precautions?
Yeah, this is something that we just jumped into head first. I have a little bit of computer-based skills from college, and I was familiar with platforms such as Google Hangouts and Zoom. And so we've had great support from our volunteers who lead our programs and getting them going. So working closely with NAMI California and making sure that we're filling any of the holes in the cheese, I sort of say.
Got it. Let's talk about a couple of communities here on the Central Coast. Obviously, as you know, we have a large Spanish-speaking community. Talk to us about how those who speak Spanish, how can they use your services?
Yeah, so our programs are offered in English and Spanish. We recognize the cultural competency within
Good.
Monterey County. And so our two programs are mainly peer-to-peer and family-to-family, but they're also offered in Spanish, which is called Familia Familia and Persona Persona. And so they have the same exact information in each of the classes. Um, and the classes, currently, we don't have any Spanish classes in progress. We just concluded our Familia Familia, but anybody who is interested in taking those programs, they can contact us and we'll put them on a wait list. Once we have a date and time for future programs, we contact those individuals and ask if they're still interested.
Great, great. And what about some of the most vulnerable, be it homeless? How are you able to reach them? How is your service able to reach them?
Sure. So actually, being that our peer-to-peer program and our connections programs are peer-led, we have great advocates within our volunteer system who are really on the front lines of COVID-19 and getting connected with the community, especially in the homeless encampments, and touching base with those who need our services. Also, we work collaboratively with different organizations in the community. Monterey County Behavioral Health and Intrum is another one. If we can't take care of an immediate need, since our focus is more on mental illness, we typically support them with other agencies that best fit their current situations.
Yeah, understood. And we just got a chat and a question. And obviously NAMI for Monterey County is from Monterey County. And if you know this, obviously we're here on the Central Coast. We got Santa Cruz County, San Benito County. And are you familiar with other opportunities for people to have these types of services up in Santa Cruz or San Benito counties?
Yeah, so I did want to mention NAMI Santa Cruz County, NAMI San Luis Obispo, NAMI Santa Clara County.
Right.
Uh, are all available as well in addition to providing resources. So if we in this situation we don't have a family to family in Spanish. So if any of the other programs have them, we definitely keep those who are interested informed.
Great, great, good. And Justin, let me ask you something. So, when should someone call NAMI? When is that? When, you know what I'm saying? When is that point where they need to pick up the phone? What's your advice to them?
Well, we recognize that this is a very difficult time for everybody, and mental illness does not discriminate. When we discuss mental illness, we're referring to conditions that affect a person's thinking, feeling, and mood. Such conditions affect abilities to relate to others and function each day. It's also important to note that each individual will have different experiences, even those with the same diagnosis. So, according to NAMI, 1 in 5 US adults experience mental illness each year. About 50% of lifetime cases begin by age 14, with 75% emerging by age 24, with suicide being the second leading cause of death amongst individuals 10 to 34. So, in getting connected with us, um, it's a variety of it's a variety of support. Typically, the circle of support and getting connected with us. It's not easy. Typically, sometimes we're the first people that individuals talk to in regards to mental illness. What do I do? How am I affected? What resources are out there? How do I get diagnosed? And so we just try to support them as best as I can and meet them where they're at.
So if someone's feeling and asking themselves those questions that you just said, they can feel free to call NAMI at any time, correct?
Correct, 100%. We're here. If we don't have the answer, we definitely can find the support.
Great, great, good, good. Anything else before we wrap up? Anything else that people here in Monterey County on the Central Coast should know about NAMI?
For more information on mental health in NAMI, you can go to NAMI.org, NAMICA.org, and you could also find us at NAMIMontereyCounty.org. There's great information on these sites for individuals who wish to learn more about mental illness. NAMI's put together a great, creditable COVID-19 resource and information guide on their websites. Topics address general information in regards to COVID, scam and fraudulent awareness, as well as connecting with others during self-isolation, plus more. You could follow us at NAMI Monterey County on our Facebook or new Instagram account. And you could also find great resources on the Monterey County SAMS Guide, 211 Monterey. And also Monterey County Behavioral Health offers free support groups as well. So for those who are interested, I highly recommend you checking that out.
Great, great. Well, Justin, thank you very much. And obviously, thank you to the National Alliance on Mental Health, NAMI, here in Monterey County and throughout the Central Coast for the services that you are providing, the free services that you are providing when it comes to our mental health here, not just during this pandemic, but at all times. And so just wanted to say thank you again. And once again, it's the number to call is 831-422-6264 for NAMI. And then if you ever have any questions about reaching out to my office and have any issues with the federal government or federal bureaucracy or any aspect of the federal government, please give us a call. Call me, Jimmy Panetta, at 831-424-2229, 831-424-2229. Now, once again, it's been a pleasure to be speaking with someone that's provided so much good for people here in Monterey County, and that's Justin Alness with NAMI. And thank you very much, Justin, and look forward to seeing you in person very soon.
Thank you for your time. I really appreciate it, Congressman.
Thank you.